Bullying is a hot topic these days. Teens even taking their own lives because of it. Now some kids are going under the knife to try and stop it. The number of children getting cosmetic surgery because of bullying has gone up 30% over the past decade. And tonight we take a look.
That's the first thing people saw. That's the very first thing people saw. They didn't see her. They saw a big brown mole on her face.
Don't smile.
Meet Kendall Elliott and her mother, Catherine. For our camera, she's a shy 6-year-old little girl, but turn them off and she shines as a cheerleader and likes to talk about her friends.
Cammy and Laura.
When Kendall was born, she had a smallish, dark mole on her face, but as she grew, so did it.
She's had it since she was 6 months old. It was real light to begin with, and then it just got darker and darker. Kids at preschool would ask if they could touch it, and what is it?
And it wasn't just curious kids. Even well-meaning adults really started to notice.
Adults would stop me in the store and say, oh, she's got something on her face. She's got chocolate on her face. Or, here's a tissue, wipe something off of her face.
So her mom decided to get ahead of the bullying and have doctors remove the mole.
I could hear some kids saying, that little girl out there, the one with the big brown spot on her face. We wanted to stop it before it became a problem.
So you feeling okay?
Kendall's parents contacted Dr. Joe Niamtu to have it removed back in August. A fairly easy procedure.
Now it's pink, and we'll continue to treat this and hopefully get a total resolution.
And of course, Kendall is not alone. 7-year-old Olivia was teased terribly about her ears. Her mother says she had to drop out of ballet class because of bullying. She often came home in tears. Eventually, Olivia did have the surgery. Now she is thriving and dancing. According to the American Society of Plastic Surgeons, there were more than 76,000 cosmetic surgery procedures on teenagers in 2011. And with this age of social media, experts say the bullying can cause problems like depression and trouble in the classroom.
Ideally, we want to correct it before they start school, because that's, little kids have no filter, and they may say something innocent like, what's that on your face, or what's wrong with your nose? However, they're also spiteful, and they tease.
The most common cosmetic surgery procedures that Dr. Niamtu performs on kids are pinning back protruding ears and removing moles, birthmarks, and scars. He says bullying, even when children are young, can have long-term effects. But even Dr. Niamtu admits cosmetic surgery is not for everybody.
We also have a body dysmorphic population, and a lot of young people come and they want cosmetic surgery. I mean, I've had 19-year-olds that want brow lifts and facelifts. That's crazy.
But for this family, it was the right decision.
It was the first thing you saw, and not her. And some people are so judgmental and so critical. And I firmly believe, I think when she gets older and looks back on it, she's going to say thank you.
But not everybody thinks cosmetic surgery is the answer or has a good experience. I spoke with the mother of a 12-year-old this afternoon who tells me her son almost died last year. He had surgery for a birthmark on his face and had serious complications with anesthesia. Now he has made a full recovery. So we want to know what you think about all this. Leave your comments on our Facebook page. Just search WRIC TV8.